In this segment, I'll speak about the treatment of moderate acne, and I'll give you an overview of what the treatment modalities are that we most commonly use to put a tab on it. I will go into the details of these treatments in a later segment. In moderate acne, we see blackheads, whiteheads, inflammatory papules, which are the red bumps, and pustules, which are the whiteheads or zits. Rarely do we see a cyst. The treatment is mostly directed against those blackheads and whiteheads, the clogs in the skin, as well as against the inflammation. And an equal amount needs to be targeted against both of these expressions of your acne. The agents that we most commonly use are also those that we use in mild acne, exfoliating agents, notably of which is a retinoid. The retinoids are prescription vitamin A products that your dermatologist provides, and they are oftentimes combined with anti-inflammatory agents. There is one that works as an exfoliating agent and an anti-inflammatory agent, that is benzoyl peroxide, that is oftentimes combined with a retinoid in the treatment of moderate acne. We oftentimes use topical anti-inflammatory agents that also function as antibiotics, such as the sulfur agents, sodium sulfacidamides, and perhaps even straightforward antibiotics such as clindamycin or erythromycin that we apply to the skin. Occasionally, we will even have to resort to the use of oral antibiotics for a very short period of time, usually about 1 to 2 months in the very beginning of the treatment, or if acne just changed over to moderate and or had a slight flare in its moderate expression. And those oral antibiotics are there to jumpstart the treatment. They are very high in their anti-inflammatory action. However, they do provide some antibiotic coverage. There are other treatments available that can tame moderate acne, such as photodynamic therapy. Photodynamic therapy is reserved typically for moderate or severe acne and is able to reduce the oil glands, and by reducing the size of the oil glands and the activity, the photodynamic therapy will be able to stop moderate acne. Other agents that we use to reduce moderate expression of acne is red light, which is directly anti-inflammatory. Red light is not a UV ray, but it's actually in the spectrum of our visible light. We also use blue light sometimes to reduce the amount of bacteria on the skin. In addition to these measures, we encourage oftentimes in moderate acne extraction facials. These are not facials and have nothing to do with a spa facial. These are actually a type of surgery in which the skin is gently opened, oftentimes just with a prick of a needle, and an inflammatory papule is expressed directly through that opening. In addition to that, a physical removal of blackheads can be performed. There are a number of different treatments that can work in this particular regard. Microdermabrasion with aluminum crystals is one of them. And the other technique is isolase, where vacuum is directly applied to the skin to remove the blackheads. Last but not least, moderate acne can also be tackled with a number of different lasers, notably the pulse dye laser, which is excellent in reduction of inflammation, and also the smooth beam laser in people who have skin types that are on the fairer side is able to reduce the size and expression of the oil glands.